Welcome to this refresher video of the UNBFAC, which is the United Nations Body First Aid course. In order to maintain the desired level of response in the mission and taking into consideration our limited medical facilities, the supplementary role that each staff member plays in the window following a critical incident is indispensable. This has led to the creation of a tailored program focused on basic life-saving procedures. Kindly note that this video is intended for staff members who have attended the 10 hours training course on the BFAC. This video will focus on enhancing the skills that you acquired during the BFAC training. Through a created scenario, we will demonstrate the management of massive bleeding, airways, chest injuries, hemorrhage, when and how to move a victim.
There is something on the road.
Shall we call the security first?
No need. I will remove it.
This scene shows a driver violating security instructions in order to remove an unidentified object from the road.
Let me go and help him.
Okay, take care, Jonathan.
Okay.
Before the first aider begins assessing and managing the victims, he should first start with the scene assessment in order to initiate the alert message as soon as possible. We have devised the acronym SCENE to help you remember how to do a scene assessment very quickly. It starts with assessing the safety of the scene, during which hazards are identified and controlled, and the first aider wears gloves and other personal protective equipment. Then the first aider assesses the possible cause of the incident, which in this case is an explosion. He then assesses the environment, which could be fire, oncoming traffic, electric cables, standing water, etc. He estimates the number of casualties in order to prioritize care if faced with mass casualty, and finally assesses the extra resources that could be needed, such as medical help, firefighters, extrication devices, etc. So in this scenario, the first aider is wearing his gloves and has identified the cause as an explosion. He sees two victims who would need urgent medical care requiring medical escort. The scene is safe for him to approach and carry out a rapid assessment and treatment of immediate threats to life. Once a proper scene assessment is done, an alert message should be conducted as soon as possible within 2 minutes of the incident in order to activate the casualty evacuation process. An effective alert message should consist of the exact detailed location, first aider call sign, the number of casualties by category, could be urgent, priority, or routine, special equipment required, could be hoist, extrication, or ventilator, and the number of casualties by type, lethal, ambulatory, or escort. In this scenario, the alert message will be emergency, emergency, emergency. Explosion in front of the Green Village main entrance. Kilo 32. 2 urgent casualties needing immediate medical and security assistance. Both casualties will need medical escort. After approaching the scene, the first aider should start assessing the victim. The acronym MARCH will help you to be systematic in providing first aid, with the most important actions being taken first. M is for massive bleeding, which is a life-threatening situation and must be taken care of immediately. A victim can die in 2 to 3 minutes if massive bleeding is not controlled. Next is A for airway. If the victim cannot breathe in air through his nose or mouth into the lungs, his chances of survival becomes very low. Next is R for respiration. For oxygen to reach the brain and vital organs, you need to make sure that the victim is breathing at normal speed and rate. The first aider checks for injuries on the chest that can affect proper respiration. C is for circulation. The victim is assessed for other types of bleeding that is not massive. And finally, H is for hypothermia. Have in mind that the body heat is lost when a victim loses blood. It is important to keep the victim warm. With his gloves on, the first aider has identified massive bleeding on the victim's left thigh. He will use his tourniquet to stop bleeding. A tourniquet must be well prepared before storage for proper use. To prepare a tourniquet, hold on both ends and sharply pull apart to stretch the free-moving internal band. To store it, place about 10 to 15 centimeters of the loose end through the single routing buckle and fold on itself. Fold the tourniquet so that the self-adhering material holds the tourniquet in compact size. Secure the strap in an open configuration. Tourniquets should be carried on a location that allows for rapid access and application in less than 30 seconds. If possible, expose the wound before applying the tourniquet approximately 5 centimeters above the wound. If not, apply it directly over the clothing in a high and tight position. The first aider has secured the rod in the clip and has recorded the time on the strap. Monitor the tourniquet for continuous bleeding and apply a second one directly above it if needed. Consider wound packing and direct pressure as additional bleeding control measures. The tourniquet may later be released only if applied for less than 2 hours, bleeding is controlled by other means, and it is not applied on an amputated limb. After taking care of massive bleeding, the victim's airway must be checked. If the victim is not responsive, his airways may be blocked. The most common cause of airway obstruction is the tongue. It can also be obstructed by blood, foreign bodies such as teeth, foot, etc. The first aider here gently taps on the shoulders of the victim and talks to him. If there is no response, consider the airway is obstructed and apply a head tilt chin lift maneuver. After opening the airways, the victim should be put in the recovery position to maintain the airway opened and allow any fluids to flow out through the mouth. Watch how the first aider performs this action. The first aider then ensures that the airway is clear and the victim is breathing by raising his chin to tilt his head back slightly. Next, the first aider is assessing respiration. He notices that the victim has rapid and shallow breathing, which is indicative of a chest injury. Any injury above the navel may be considered a chest injury. Chest injuries are confirmed by air bubbles coming out of the wound and may be associated with hissy sounds. The first aider immediately covers the wound with his palm, then prepares the chest seal, cleans off excess blood and debris, and applies the chest seal while asking the victim to exhale. He then rolls over the victim to check for exit wounds on the other side of the chest. The next thing for the first aider to assess is circulation. He has identified a deep wound on the victim's left forearm. In case of a deep wound, you may consider wound packing for bleeding control. First, expose the wound. Then insert the gauze using your finger as deep as possible to apply direct pressure on the bleeding vessel. Then pack the rest of the gauze as shown on the video. Since this wound is deep, he does wound packing before applying the pressure bandage using the V-wrap technique, making sure that he maintains the pad clean and protects the wound from infection. Care should be taken not to apply the emergency pressure bandage too tight as it may become a tourniquet. It is very important to check the distal circulation, sensation, and movement after applying the emergency pressure bandage. As for head and scalp injuries, bleeding control might be considered challenging. The first aider uses proper technique in applying the emergency pressure bandage with enough pressure to avoid it from slipping. Once victim assessment is complete, please keep in mind that the victim must be maintained warm and comfortable. Victim assessment is dynamic and should be repeated until medical assistance arrives. Do not move the victim unless the surrounding environment becomes unsafe and his or your life is in jeopardy. There are different techniques for victim movement. In this scenario, the first aider demonstrates a single-person dragging technique. As we saw in the scenario, all of these skills are simple and easy to learn. However, they require a lot of practice to master and to be able to use them in a timely manner. We have come to the end of this video. I hope you liked the scenario. If you have any question, please don't hesitate to contact the Joint Medical Services. Thank you and goodbye.